Dr. Jonas Apostol.
Hi guys! So, February na. Ang bilis ng panahon. So, love month na naman. So, may mga dates na ba kayo? So, pag wala pa, well, you have to love yourself first. Okay? Kidding aside, so this patient, nag-focus siya sa sarili niya. So, ang plan niya is to, focus more on herself, loving herself by improving the smile. Okay? Enhancing not just the smile but also the health of her teeth and mouth. So the patient went to my clinic with the chief complaint of having this very obvious restoration, okay, and also a missing tooth on the upper right premolar area, and as well as infection on the front tooth. That's why medyo hindi na siya happy, okay? So let's talk about the patient's case here. So as you can see, multiple composite restoration, direct composite veneers, presence of cavities, and uneven distribution of the width and the sizes. No? Medyo, the two front teeth, medyo a little bit off midline and canted. And we really have to correct all these morphology and anatomy of the teeth kasi hindi siya talaga maayos or not distributed equally. So we have to make sure that we deal with the infection as well. So as you can see here, there's a pimple-like appearance. That's a fistula. Diyan lumalabas yung infection because the tooth here is infected. That's why we refer the patient to our endodontist to deal with the infection. So health is very, very important. We have to address it first before we can do a further treatment like the restoration of the tooth structure. The usual protocol in the clinic, kailangan we have all the diagnostics, clinical radiographic impressions para ma-analyze natin yung occlusion and also the distribution of the biting force, and also we have to check the arch and as well as the totality of the movement of the teeth. That's why a thorough assessment is necessary in order for us to create a definitive treatment plan for the patient. So what is a treatment plan? So first, address the problem ng health. Like number one, yung infected tooth, which is root canal. That's number one. Number two, the combination of a veneers, crowns, and bridge to be able to match everything. Also, dental implant is one of the options that we consider, but the decision would always be from the patient. She wanted na medyo conservative, and since there's like huge cavity on the premolar, let's do the usual fixed bridge. So the material used for this is Emax porcelain, and for the bridge, zirconium oxide infused with porcelain as well. So after the root canal treatment, about 2 to 3 weeks after, start kami with the restoration process now. So why 2 to 3 weeks? So that's the recommendation of our endodontist, because there are some cases that we cannot go straight right away with our restoration. That's why we have to collaborate with the specialists, especially root canal or other dental specialty. So this is not just a one-man team, but a pool of specialists in the clinic working on one patient. So of course, before we do the teeth preparation, we have to make sure that we have secured the design suitable to the patient's case. So in doing a smile design, we're not just considering the exact sizes of the teeth, but also we have to consider the lips and also the totality of the face. And also, the patient requested for a natural looking color to complement the lower para hindi masyadong ganun ka-off. But she wanted a bit whiter than the original kasi mas bagay sa kanya. And also, I agreed with the suggestion, kung ano yung mas maganda sa patient na hindi naman siya fake looking, and it will be an advantage for her aesthetically. Okay, so with the teeth preparation process, it took me more than expected. I mean, extra time kasi I did a lot of build-ups with this one, making sure that everything's cavity-free. I removed all the carious cavities, and then considering all aspects like the soft tissue, the gums, that's really important. And soft tissue management is not easy, especially for some cases. That's why sometimes it will take a bit longer than expected. Usual kasi is like an hour or two, but for this, like more than 2 hours ata ako dito with everything na. Yeah, but because it is like not a straightforward case. So after teeth preparation, of course, yung patient, she received a provisional, yung temporaries namin, that lasted for 10 days. No? So she waited for that duration because we are creating a ceramics in the laboratory and making sure every details na ayos. So,
several days later.
after 10 days, that's the time na nag-try-in na kami. So during try-in, syempre doon makikita natin if okay na, like color of the ceramic used, and also the size, the shape, and the fit. That's the most important, because if not properly parang swak doon sa mga margins, then it could pose a problem in the future, and we don't want that. And that's why we really have to make sure that all the details must be on point, so that it will prevent us from having problems and difficulties after or in the future. So yeah, doing it right from the very beginning is very essential. So after the try-in, patient agreed and happy with the appearance, everything. So yun, nag-decide kami, the patient, na ituloy na namin the cementation process. Like the try-in, siguro mga 15 minutes lang, and then after that, boom, ready na kami for final cementation. Because walang hula eh. From the temporary pa lang, I did the designing na. So makikita na natin like the proper height and the color and the distribution doon na. So usually kasi, pag we get all the details, tuloy-tuloy na yan. But if, you know, you change your mind, pag yung may patient na ganon, like, they change your mind, they want this and that and this and that. Nagbabago, so naiiba, pumapangit, nagkakaroon ng problema, and yun. That's why this patient just, you know, trusted me with the design that, you know, suitable for her, and wala kaming problema, like super fast, super bilis lang ng everything. So here is the result. Okay, as you can see, it's very beautiful. It looks whiter, brighter, but natural looking. So this is a combination of veneers, crowns, and bridge. And the color is not too white, it's A1, and a lot of translucency just to create balance. And also, it's very durable. The patient can eat normally, and it's stain resistant. There's no parang problem with mga discoloration, especially with coffee drinker or tea drinker individual. So ito, very beautiful and good material of choice. Pag pinapabalik namin for the follow-up, doon na kami kumukuha ng mga pictures, lahat ng details. And also, we did cleaning, removal of the excess cement. That's very important, because we cannot ensure and guarantee that we can remove all the cements in just, you know, after the day of cementation, because there are like remnants. So to ensure and guarantee that there will be no excess that would pose a problem in the future, like gum problem, dapat kini-clean din siya. And then also night guard, na sa night guard din, kinukunan ng sukat for the night guard as well. So you can see here, different aura, different attitude, different countenance. It's like a different person, because we were able to address the insecurity, okay, the problem, and we were able to enhance the appearance. So pag gawan mo ng paraan yung problemang yan, it will really brighten your face. Not just the teeth, no? So, it's very, very good decision for the patient na, you know, loving herself and putting more importance and putting more effort. Alam mo, sometimes it's really difficult and hard to like address your problem. Kahit minsan, even if you have the budget, pero yung courage mo to face the reality and go to a dentist just to, enhance everything. Parang nakakatakot yung thought na yon. Pero it's a good decision kasi parang you have to dig deeper kasi you love yourself. She loves herself and she did the right decision. We just make things right. The health improved, the appearance improved, and also the soul nag-ease up, mas happier. So that's the real essence of an apostolified smile. And that's it. Thank you for watching. Until the next vlog.